Hello, my name is Noel Fernandez, and I would like to welcome you all to my presentation, Healthcare in Third World Countries. Now, before we begin with the material, I would like to provide you with some facts about the topic to get you familiar with what we'll be talking about. Some facts to consider. Did you know that globally, 844 million people lack access to clean water? Out of that population, more than 800 children under the age of 5 die every day from diarrhea caused by contaminated water, poor sanitation, and unsafe hygiene. Secondly, in 2015, approximately 1.6 million Africans died from treatable diseases such as malaria, tuberculosis, and HIV-related illnesses. Now, this is a very high number of deaths that have been caused by diseases such as malaria, because there has been a known cure for malaria for over 70 years. Yet these diseases are still taking numerous lives every day in these countries. Lastly, less than 2% of drugs consumed in Africa are produced on the continent. Let's define some basic terminology. What is healthcare? Healthcare is defined as efforts made to maintain or restore physical, mental, or emotional well-being, especially by trained and licensed professionals. What is a third world country? Now, to provide you with some brief history behind the term third world country, there was a French demographer named Alfred Sauvy who wrote, "Three worlds, one planet," at the brink of the Cold War. Third world countries were those countries that remained unaligned with either NATO or the Warsaw Pact. Now, because most of these countries that were categorized as third world were impoverished, the term became synonymous with poor world. Some people believe that third world is an offensive term, but it is still commonly used today to describe these countries that have a very high poverty rate and very high disease rates. Uganda, Yemen, and Somalia are some examples of third world countries. So what healthcare problems are these third world countries facing today? First up is water supply. The study conducted by Cronk and Bartram, they compiled data of 78 low and middle income countries, and it was representative of nearly 129,000 healthcare facilities, and these were some of the results from their study. First, we have 50% of healthcare facilities lack piped water. This is a significant amount because water is used all throughout the hospitals. Mainly, you want to keep patients and staff hydrated, especially in the countries where you have extreme weather, very hot or very cold. You want to be able to prevent stuff like hyperthermia, hypothermia, and also for procedures, etc. Next, 33% lack improved sanitation. Now, this is also critical because you want to be able to maintain a clean environment in the hospital. You want clean hands. You want to reduce cross-contamination between patients and staff, and just limit these outbreaks. Next, 39% lack hand washing soap. Now, it is obvious that you have to maintain a clean environment. People have to wash their hands. It is actually the #1 most effective way of preventing germs from going everywhere. You also want their healthcare workers to be washing their hands between patient interactions, and before and after procedures. Next up, 39% lack adequate infectious waste disposal. Now, every hospital you go to, at least in the United States, they have sharps disposal, they have biohazards, and they have a special waste that just cannot be mixed with regular trash. And this is vital because some of this it's a health concern for the people that manage the trash, but also for like landfill purposes. Next, 73% lack sterilization equipment. Now, This is the biggest percentage we've had, and it's probably one of the most important ones, because anything from a minor procedure like suturing to all the way up to surgery, you need sterile equipment to be able to limit infection rates and so on. And lastly, 59% lack reliable energy services. Now, it's a given that you want a steady power supply, and like I said, with extreme temperatures in countries like in the Middle East, for example, you want to be able to have air conditioning units. You want to have heating units at all times. Lack of medications. Now, recall the fact I told you not too long ago about how less than 2% of drugs consumed in Africa are produced in the continent. Now, you might be asking yourself, why is this significant? Plenty of countries nowadays outsource their pharmaceutical production to cut costs. The problem with these low-income countries is that their healthcare budget is tight as it is. It becomes more expensive to acquire medications, especially that they're not able to do as bulk purchases, and it becomes more expensive. Medical staffing. Developing countries such as Syria, Afghanistan, and Kuwait depend on other countries to provide medical personnel year-round. On the civilian side, we have Doctors Without Borders, and that's an international humanitarian medical organization that originated in France, and they provide healthcare workers such as doctors, nurses, and technicians to serve in impoverished countries and those affected by endemic diseases. Doctors Without Borders has provided over 35,000 healthcare workers and has been active in over 75 countries. The United States Military Medical Corps, which consists of the Army, the Navy, and the Air Force, deploys troops, again as physicians, nurses, and technicians, to combat and non-combat locations to staff healthcare facilities. And not only do they provide healthcare workers in land operations, but also in amphibious, because the Navy has ships that are in the ocean at all times, and they are also fully equipped with hospital-like settings. Another staffing problem is that an estimated 40% of donated medical equipment, such as x-rays, your CT scans, that are donated to these countries, are out of service. And this is because they also lack biomedical technicians to fix problems when they arise. Some of these issues, like having a piece of your x-ray machine break, can be a critical component and cause this machine to stop working. But sometimes an x-ray machine has to be put on hold for being fixed because they have to deal with ordering more medication, such as antibiotics. It's more of a need and want basis. Considering all of that, the question remains, should the United States and other financially independent countries provide manpower and financial support to other struggling healthcare systems? Is this the right thing to do? You might say, of course, these poorer countries need our help, and we have the resources to do so. I believe that all healthcare workers have this heroic mentality, but to be honest, they get sued all the time. So sometimes it's not about being the good guy all the time. Not only do the providing countries have to deal with the financial burden, but they also have to consider religious and cultural differences. With that being said, there is a court case that was reviewed by the Superior Court of Pennsylvania about a married couple refusing to consent to a blood transfusion for their child after they had been advised by the physician that the child really needed this procedure. Now, the refusal of care was based on the parents' religious beliefs as Jehovah's Witnesses. It is typical for them to deny blood transfusions, and this was one of the cases. The court held that the state could act to promote legitimate interest when the parents, in this case, have they have religious beliefs that that may put a child in imminent danger. You might be asking yourself, what does this court case have to do with these third world countries? And the answer is simple: is that Jehovah's Witnesses are noticeably active in third world countries such as Mexico and Brazil. So in these cases, to put it in simple terms, a doctor could go to the lawyer and they could do a court order to go past the parents and have a procedure done in the best interest of the child. And here we have a chart of active Jehovah's Witnesses in third world countries. And here we have the Republic of the Congo, Nigeria, Brazil, and Mexico, all in descending order of population. So the Republic of the Congo, we have 216,000 active Jehovah's Witnesses in third world countries. Nigeria, we have 381,000. Brazil, we have 858,000. At Mexico, we have 871,000. Studies in low-income countries point to a significant association of common mental health disorders with female gender, low education, poverty, lack of access to running water at home, and experiencing hunger. Low-income countries have limited resources for mental health care, and some reasons for this may be that there is a lack of support from scientific journals because a lot of these countries, they lack research hospitals and physicians and PhDs to conduct research. And secondly, there's a low community participation in mental health outreach. There is a stigma that one may be seen as weak for trying to go to a doctor for a mental health disorder such as anxiety or depression, especially in males. And in these countries where the males are the head of the household more often than not, and they don't really see that as a viable option. Suicide is a major public health problem in India, specifically with women outnumbering men. Some cultural barriers include not valuing the fact that mental health is an important factor in a person's life. So again, the stigma that someone is deemed weak for going to see a psychiatrist, a psychologist, the lack of resources available to the public. Again, if the citizens are not in these communities are not seeking mental health, the hospitals are not going to be providing funding for these departments, especially with how expensive it can be to, have a psychiatrist, have these mental health clinics, and the high amount of mental and neurological problems that are already present in the public. I believe the average person in a third world country waits over a year to be seen by a mental health a psychiatrist or a psychologist, and by that point it's too late. There's been some possible irreversible damages, so it is always important to seek out these services when you think that it is necessary. Now, Jairam Goud and Srinivasan conducted a study in overcoming cultural values in order to deliver mental health care in southern India. They developed a plan targeting the treatment of indigent women, integrating mental health with primary care, making care affordable and accessible, and most importantly, making this program sustainable. Now, that is one of the most important aspects to this. Countries like the US can provide funding for these programs, but if the countries can't keep up with it on their own, then that's when we start seeing problems with these countries becoming too dependent on us. We want to teach them a way. We want them to get a hang of it and be self-sustaining. And also, it's important that they're integrating mental health with primary care, because they've seen that these women suffering from anxiety and depression are starting to have physical signs. So that is something that it will help when they see their primary care physician. They can kind of knock out two things at once. One of the most surprising things about their methods is that in this plan of integration, they actually are hiring indigenous caseworkers for these systems. So people that are coming in as patients, they're being trained afterwards and employed in these systems to be able to provide like a more welcoming environment for the people in their community, which is something that's very important because we want to break that stigma of feeling that, you know, someone is deemed weak for seeking mental health. Let's again refer back to the fact that I mentioned earlier. In 2015, approximately 1.6 billion Africans died from treatable diseases such as malaria, tuberculosis, and HIV-related illnesses. Now, here in the United States, you know, one person might take it for granted. Someone has an issue, they go to the hospital, it gets taken care of, and they're on their way. In these developing countries, you have people that are dying of diseases that there's already been a known cure for, but they can't afford it. They're not able to keep clean environments. They can't afford those antibiotics. So it's something that we might take for granted, but it's crucial for millions of lives in these other countries, children and adults. So the inequities are apparent. Malaria, in this case, the treatments were discovered well over 70 years ago. I believe in 1938 when they first came out with a treatment for malaria. But it's the year 2021, and we have many cases where we're still having malaria-related deaths. Another deadly organism that claims people's lives every day is cholera. Now, cholera is an acute diarrheal infection caused by ingestion of food or water contaminated with the bacterium Vibrio cholera. And this can be by drinking the contaminated water, cooking with the contaminated water, and so on. Children playing outside. There's many ways, and they're having a difficult time trying to keep this from happening. Some countries, such as Somalia, they have continuous outbreaks. Cholera does remain a global threat to the public health, and it is a sign that there is a lack of social development. These countries are found to be very stagnant. They're not developing, and obviously this is a rate limiting factor, as some of you may know. You can only grow as fast when you're losing a great amount of people from your population to these diseases. So that's something to consider when, you know, the United States and other countries are providing funding for vaccines, funding for purifying water, and so on. Researchers have estimated that every year there are roughly 1.3 to 4 million cases and 21,000 to 143,000 deaths worldwide due to cholera. Back in 2017, a global strategy known as Ending Cholera, a global roadmap to 2030, they set out with a mission to reduce cholera cases by 90%. And some of the countries that are very have been known to have really bad outbreaks of cholera are Egypt, India, and the Philippines. Okay. So back in 2016, the Food and Drug Administration, also known as the FDA, approved the first oral vaccine for cholera infection. Now, cholera has a low incidence in the United States, but there's a very high incidence in places like Africa, Southeast Asia, and other locations like we've spoken about. We have Somalia, Yemen, etc. These areas do draw travelers from the U.S. and other more modern countries. So cholera can present in these people, and once these people travel back to their countries, that is when some cholera cases have been seen here in the United States. So it is very important that travelers do get these vaccines, because someone like myself that doesn't travel very often, especially out of the country, it's not very common that a person like me will have to get a vaccination, but it's something to consider. Okay, the Global Alliance for Vaccines and Immunizations, also known as Gavi, the Vaccine Alliance. Gavi vaccinates almost half of the world's children, giving it tremendous power to negotiate vaccine prices that are affordable to the poorest countries and remove the commercial risk that previously kept manufacturers from serving them. So it's very important that they're dropping these costs, because, like we had said, you can't have a developing country can't make progress if we're not having those vaccinations to lower those mortality and morbidity rates. In 15 years, just 1.5 million doses of cholera vaccine were used worldwide, and in 2018 alone, this figure had increased to over 17 million doses. Now, all those doses significantly reduce the chances of a child under the age of 5 to die early on. And Gavi also receives funding through like the Bill Gates Foundations, UNICEF, etc. Now, we have talked about how these countries, they lack those clean water supplies, they lack medication, they're unable to maintain their equipment. Some of them don't even have hand soap, like we had spoken about. These are such simple things that we may take for granted. We might be sitting here having that assurance that if something happens to us, we can go to the hospital, receive that care, and be on our way. These countries, they don't have that option. A lot of these children, especially, are born into like these rougher places in Africa, and they're dying at very young ages because these countries can't get forward. They're stuck, and instead of making progress, it's like they're going back. So it's very important for countries to consider developing strategies to not only provide with these countries so that they can move forward, but so that they can be self-sustaining. Nobody wants to just keep dumping money and making someone dependent. We're trying to do the opposite. We're trying to teach them and get them to be on their own and progress. Now, as Christians, we can refer to Proverbs 14:21. Whoever despises his neighbors and is a sinner, but blessed is he who is generous to the poor. The Christians are always seeking to go out of their way to help people, and then you will be rewarded. So countries have to consider, there are all these children that are being born into these horrific lives where they're not even really getting a chance to live their life because they're dying of such treatable diseases. And it's our responsibility to provide that funding, provide that education, and keep providing healthcare workers, whether it be through Doctors Without Borders, the Peace Corps, the military. Those are all very vital systems that the U.S. has in place, helping these countries. And also Gavi, providing funding for vaccines and vaccinating all those children. So that is the end of the presentation on healthcare in third world countries. My name is Noel Fernandez, and thank you for watching.